it seems that healthcare providers are under so much pressure to contain cost. Margins are probably the thinnest they've ever been in a long time. You're seeing a lot of mergers and acquisitions and consolidation of medical practices to gain some economies of scale. So should every medical provider expect an annual audit, or is it random? How does that sort of work from an exposure standpoint?
Yeah, great question. So it is random, but to a certain extent. But what happens is either whether the third-party auditors or one of the payers hits, if you will, on a given specialty. For example, two of the biggest targets right now are integrated practices, what is commonly phrased MD, DC, PT practice, where there's a cross-pollination of clients, holistically treating the patient. And then also, sadly, egregiously, and I dare even say grossly, is addiction treatment centers. So, and that's a good place to just kind of talk about it, is as the addiction epidemic it continues, but as it grew, if I were to put for you on a chart the growth trajectory of the epidemic, the loss of life and continued growth of those with substance use disorder, and the health insurance carriers' declination of permission of detox, the shortening of length of stay for inpatient, the fail first positions to manage the healthcare spend, you'd see just it's maddening data. But what has happened is those two areas of healthcare have been hit the hardest as of the last 2 to 3 years.
And is there a reason per se, or because it's such an emerging area of care, that's where the attention is being focused?
Both.
Okay.
Both. So you see the billings increased. I mean, if the care increases, the billing's going to increase. And you have the discussions with people in the marketplace, and they say, well, you know, those particular facilities are, whatever they're talking about, they're very fraudulent. They're billing, well, they're treating patients at a very high level, a very high quantity of patients. So the billings are going to go up. I mean, you're always going to have the outliers.
Sure.
Are there people that act fraudulent? Absolutely. Are there people that are not doing it for the care? I mean, every business needs to make money to keep treating patients and to keep the doors open, but sure, they exist. They're the overwhelming minority.
Interesting.